kind of thing. And I bumped into the Christina from the patient experience office in a coffee shop, a wonderful coffee shop in Aurelia. And she invited me, she said, I've been thinking of you and I wanted to connect with you. And she invited me to join a team that was working on um, improving the discharge experience. Sorry, did you get enough information at discharge? And so I joined a team, a multidisciplinary team with people from across the hospital, and where they were working on how do we improve the experience. So it was interesting for me because I was able to bring the experience from my mom's perspective, but it was kind of limited because she just moved from hospital to hospice. But also brought the experience, my own experience. I've been in the hospital a number of times for different things, and so have experienced discharge in a variety of ways. So we started with realizing that we need more information and need more direct information. That's great that I'm involved as with a patient voice and a caregiver voice, but we decided we needed to find out more direct information from people in Aurelia at Soldiers. So I worked with Christina to develop some survey questions, and some volunteers surveyed people who had recently been discharged about their experience. And so that information from those interviews came back to the committee. And then as a group decided that putting together a short, brief pamphlet would be a helpful thing. And they showed me the infection prevention and control pamphlet that patients have, which is really brief top-line information to give patients and families information about that, and said, could we put together something like that? At the same time, I've been doing some volunteering with the Ontario Caregiver Organization, and I learned about the quality standards that exist with Ontario Health, and I didn't even know anything about that. And the session we were working on was for the quality standards for COPD. But in doing some research for that, I learned that there are quality standards for discharge from hospital and transition from hospital to home or hospital to wherever. And so I looked at those quality standards and mocked up a very simple pamphlet that soldiers could use to give information to people with at discharge. So basically with one statement about what to think about in various categories, and then some points or questions to reflect upon. Now, the quality standards have a whole lot more detail, and we were trying to not have too many words on the paper. So we I made it brief, and then working with a new patient experience office person with Laura shot that around to a variety of groups to get input, people like the PFAC and the staff, etc. And so we got some feedback, improved it, and then now this is being piloted and tested in a few different places in the hospital just to get some response from patients. So it's been a longish process. But for me, really enlightening to see the steps that we can go through, and also to see all the different people who have input in a part of it. It's given me a glimpse into hospital life. I see how busy people are. I see how hard people are working, and it's been a good learning experience for me to be involved. I look forward to seeing where this goes, to see did you get enough information at discharge, to hear what response people have when they look at the pamphlet. Is it too many words? Is it helpful for them? What's helpful, what's not? And then see where it goes. And I'm interested in seeing, can it work across the hospital? The hospital is a big place with a lot of different sections for different purposes. And so what might work one place might not work in another place. So I'm interested in seeing that. And I'm also interested in circling back to the original reason I got involved at Soldiers, which is about patient and family-centered care and the visiting policy, and working together with caregivers as part of the care team so that caregivers can feel included, and the hospital can benefit from having caregivers involved. So that, I've been thinking about what do I feel like needs to be changed in the healthcare system, what could be improved. And I keep circling back to that human-centered care and and seeing what difference can be made there.